My melanoma journey. This is graciously Gloria. Today I'm going to share with you my skin cancer journey and some different things that I've learned about skin cancer. So first off, the beginning of my story actually starts with my squamous cell cancer on my face. So I had what I thought was a pimple on my face. And I thought, being in midlife, sometimes you start to get acne. I hadn't had much as a teenager, but I thought, okay, maybe this is what's happening now. And so it was on my face, and I thought, it's not going away. And I'll put what people put for a pimple, like salicylic acid, that kind of thing. And it didn't go away. Then I was like, well, I'll try Neosporin. Okay, it's still not going away. And it was so itchy. It was really itchy. So I contacted the dermatologist and said, look, I have this spot. It's really itchy. Do you have a cancellation? When can I come? And I went, and the dermatologist looked at it. I thought they were going to just give me some kind of cream, but she was like, I don't like the look of that. And so she took a biopsy, came back pretty quickly, squamous cell. So they ended up doing a Mohs surgery on that. So one sign that I learned about skin cancer is that sometimes it is itchy. I believe it's about 40% of the time it could be itchy. So if you have a spot that's itchy, that is something to try to get checked out. So that was my first part in my journey of skin cancer. So also what I learned is that Silogen really does help a scar go away. So I put that on. They said to put that on every day for about a month or two. I put that on every single day, twice a day for a year. But you can barely see my scar. So I think it was very worth all that extra effort. And what I also learned is to put on daily sunscreen on my face and neck. And that's really important. So I started doing that, and then I would go to the dermatologist more often. At that point, they had me going every 6 months. And so my doctor is actually the one who saw the melanoma. I guess I should back up slightly because I was having different things removed every single time I would go for biopsy. And I have what they call dysplastic nevi. So those are just abnormal. They're moles that have abnormal cells. They're atypical is another way they use that. And they can be categorized as a mild atypia, a moderate, or severe. So I had different ones that were mild. Initially, she found those, and she said if the more of those that you have that are mild, dysplastic nevi, that also gives you a higher disposition to get melanoma. So she was really keeping her eye out for that. She found something that was actually, mine was a color shade of pink, and it was on my shoulder. And so she sent that for biopsy along with other things to biopsy, and came back stage 1 melanoma. So it's PT1A is what I had. And so that tells you, the stage tells you how far in depth it's gone. Has it gone also to the lymph nodes? Has it gone to other organs in your body? And so the further that it spreads, then the larger diagnosis you're going to get for moving to a stage 2, a stage 3, or a stage 4. So I was fortunate enough that they caught mine earlier in a stage 1, and the Clark also tells you how far it goes down, and mine was a Clark stage 2. So there's different terminology to learn about all of this, and at first you're like, well, what is this? And I actually got the results quicker from my portal than before my doctor even called to tell me. So then I'm like Googling all of it to try to find answers, because it was right around Christmas time. And then they end up calling me after that and talked to me and told me that I would be sent for surgery. So I had surgery, and a great surgeon who had done the one on my face, the Mohs surgery, and really think he's excellent. Was really stressed about, what does this mean? They assured me that at that point it hadn't spread, and so that surgery should get rid of it, and they will make sure they get the clear margins. And so had the surgery. It was over about 3-inch scar for something that was not that big. So that's the surprising part. They have to take out so much of the skin to get the clear margins, and they have a protocol of how much they need to take out based on the staging. Luckily, at my stage, I didn't have to get lymph nodes tested or do other treatment at that time. So felt very fortunate. I would say the healing process, it's painful to get that much skin taken out of you. And it was painful to sleep on that side for quite a bit, and took different, like Tylenol, then like Tylenol PM, different things to help with the pain. And in addition, making sure to follow good protocol to keep it clean. Luckily for that one, they put a waterproof bandage, so I didn't have to deal with like the daily cleaning like I did with my face. And until they had me come back, until they had me come back to take out the stitches, and then I cleaned it. And Aquaphor becomes your friend. Also, I would say what I learned too is that for scarring, I think back when you're younger, they used to teach you like, oh, you went roller skating. Let's say you skinned your knees, let it dry out, let it scab. That is not the way to have it heal. You're going to get scars. So you actually want to keep it moist. And using Aquaphor, really, if you could use it every day, that would be helpful to minimize your scar. And so I put it on all the time, and my scar is actually looking a lot better. Now, after that, then I got bumped to that from the squamous cell. I was getting checkups every 6 months. Once I got the melanoma, then they bumped my checkups to every 3 months at the dermatologist. And they were finding more things each time, more things to biopsy. And then I had a severely dysplastic nevi. And so for that, they also do a surgery for that, because that one is a little bit harder to distinguish between that and a stage 0 melanoma, because the cells are so abnormal at that point. So that one, I got a surgery for that, ended up being around about a 2-inch scar for that one, also on that same shoulder, a few inches below. That one was more like a shade of like a brownish black mole, I would say, on that one. And then I saw other spot, like, so then you'll start to pay attention more to like any spot that you think is changing. Sometimes it's hard to gauge that because you have new spots that appear and you're thinking, was that brand new, or that was already there, or has it changed? It is a little bit difficult to gauge, but be aware of your own body, and doing those checkups are really important to check your own skin. And so I had another one that they biopsied and got me in right away. I would say my dermatologist is great, and don't hesitate to contact your dermatologist if you notice something. And at least mine, they bump you in priority since I had melanoma if I call something out and I think that something's changing. So that's important. I had one, for example, that is on my other shoulder, and it initially came back as a moderate dysplastic nevi. And then at first they were just going to keep an eye on it, watch it, and because it wasn't quite severe, but it grew back quickly. Like right away, it was already like growing back. I was already noticing something growing back practically like as the like biopsy spot was healing. And so I contacted them and said, hey, this is already growing back. So they decided then just to do a surgery on that as well. And so I have a scar. It's not as big on that one, but I do have a scar from that. And again, had to deal with the healing of that. So on my journey, it's very scary to get diagnosed with melanoma, because even when you're at an early stage, you don't know what that means as far as reoccurrence. What I learned is that you have a higher likelihood to reoccur within the first 5 years. So usually, if it's going to reoccur, it's more statistically likely. Again, that's going to be in those first 5 years. Doesn't mean that it's not going to occur 10 or 20 years from now, because you can have some rogue cells, microscopic cells that go rogue and go in your blood system, in your lymph node system, and then they reappear somewhere else within your body. And sometimes they don't even reappear necessarily as another mole. It could just reappear. Melanoma likes to go to places like the brain, the lungs, and the bones. So that's really scary, knowing that it could just reappear at some point, even if they got clear margins. And I've read plenty of stories where that did happen. And again, I've read plenty of stories where people were okay for like those 5 years and even 10 years. And so there is hope in that. But it is something just to know, always be on top of getting things checked. And what I like to say is that still go out and enjoy your life. You want to increase your sun protection out there, but don't be afraid of going outside and enjoying your life, and being afraid of going in the sun. And I see too many stories. I think that people are afraid of that. And I can understand the fear. And I especially have a lot of empathy for people who have the latter stages, like stage 2, stage 3, stage 4. And obviously then that would create a larger fear because you have to go through more treatment. The treatment out there is advancing quite a bit. And they now have things like different immunotherapy that's working well for people, even in the latter stages where it was really quite a death sentence to have a stage 4. But there's people who are living longer, even though they've been diagnosed with a stage 4, and they're in something that's called NED, no evidence of disease. So that means at the current time, no evidence of disease, and hopefully they stay in that and it doesn't reoccur again. So that's a little bit about my journey with skin cancer and where I'm at. And currently, I have been what they call promoted to, now that I've gone through so many times of 3-month checkups, every time with more and more biopsies, though. Still have never gone without having some biopsies, usually 2 or 3 different sites that they're sending for biopsy. They have decided to move me to 6 months. I don't know. I feel a little bit like, yes, yay, I don't have to go every 3 months and get more and more things biopsied. But then there's a hesitation there, thinking like, well, now if I'm going a little bit further, does that mean that if they find something next time, that it's going to be a little bit further along in the process? Like I had a melanoma, but they didn't catch it quite early enough. So there's that hesitancy there, but I am currently now on a 6-month rotation at this point. So wanted to talk a little bit more now about like what is melanoma and what are the things that you can do to help prevent skin cancer, and kind of dive into that a little bit. So melanoma, you have melanocytes, and those are the cells that give your skin pigment. And so if those melanocytes go rogue in your system, then you can develop melanoma. Melanoma is a much more deadly cancer compared to the basal cell or the squamous cell. Not that those ones don't cause issues and people have to have surgeries on those, and Mohs surgery, skin grafts, all different things. And I'm not minimizing what those people go through, um, because that's, you know, skin cancer affects people. And so melanoma can travel throughout your whole system. It may not just stay on the surface of your skin. It likes things like the brain, like the lungs, like the bones. It can go into the lymph nodes. So it can travel. There's also people who might have a misconception of, oh, I could just get a melanoma, let's say on my arm or my leg, which you could, but it can be also other places that you may not have considered. They have mucosal melanoma. So that's going in, like in your mouth, let's say, in your genitals, let's say. And so you also have the kind that is acral, and I'm not sure if I'm pronouncing that right, but that's the kind that goes, it could go on the palms of your hands. It could go on the sole of your foot. It could go underneath your fingernails or underneath your toenails. So it can be found in those places too. I actually did have a mole on the bottom of my foot, and it had been there and it was fairly new, like it maybe just appeared like about a year ago. But my doctor had seen it, and then the next time she saw it, she was like, wait, is that new? And I said, well, no, that it was new last time, but I think you did see it. But I don't know if it's changed, but I guess I need to pay more attention now to see if it's gotten bigger. And it wasn't really that big, but she decided she wanted to send it for biopsy. And oh my goodness, that little bit that was biopsied was painful because it's on the bottom of your foot. And I can't imagine how, when people have to have the surgery on the bottom of their foot, how painful that might be, just because that little biopsy spot I thought was more painful and took a lot longer to heal than my other biopsy spots have. So definitely can go there as well. So that's another kind of melanoma. And then it can go also in your eye, ocular melanoma. So I would say if you've been diagnosed with melanoma, it's really important not only to keep up with your dermatology appointments, but to keep up regular appointments with your dentist, because maybe they might see something inside your mouth, and your eye doctor, because they might see something happening inside your eye. And so you would have perhaps some other symptoms if it's growing, but they might be able to catch it earlier for you. I'm going to add my readers for this point because I want to make sure I cover all the information I wanted to give you. Melanoma is one of the primary causes of melanoma is UV damage, and it could be past UV damage, so where you got a lot of previous sun exposure. So for example, in the 80s, it was really popular to get a nice tan, be like the Band of Soleil girl. We would compare tans and like, how tan are you? And oh, I'm tan. And so tanning is actually damage to your skin. And I didn't realize that back then, but now I do. And I would say the tide has changed a little bit. I feel like on that, as far as people are feeling it's healthier not to be as tan. And tanning beds are not as popular. But I would say people still go to tanning beds, and actually you have a higher risk of getting melanoma statistically if you use a tanning bed. So be aware of that. And be aware that tan means damage to your skin. So there's a lot of fake tanning out there that's good. People put all kinds of different creams on, or spray fake tan if you feel like a need to get a tan. I now don't really feel the need to have a tan. I'm kind of embracing what they call love the skin you're in. And I'm going to love the shade of skin that I have and love the skin I'm in. And so that's what I'm going to do. But make your own decision for yourself. And if you're going to do tanning, then do the fake tanning. Okay. So I really encourage you to do that. The other kind of things that contribute to in your increased risk are, so like I said, UV exposure. Like I mentioned, UV exposure is something that can contribute to skin cancer. Now, I'm going to say a little caveat there for me is I'm not going to be afraid of getting outside in the sun, but I am going to be much better about protecting my skin from the sun. So I made a whole separate video on different things to protect yourself from the sun, different clothing, hats, things like that. There's even different makeup in addition to sunscreen that you can use. So I think it is still good to get outside, and it's healthy to be able to get outside. Is good for your mental health, I think. So I personally have decided I'm not going to be afraid to go outside, but I am going to be better about putting on my sunscreen. So I currently wear my sunscreen on my face and neck every day, even if I'm going to be inside, because I did learn even in your house, through your windows or your car, you can get those UV rays coming in. So you want to protect yourself from that. I also keep a little sunscreen stick to cover up my hands. I got gloves. I'm not really caring to wear those, but I also put that on my hands, especially too, I get dippy nails, and that also helps protect my hands when I do that. Some other things that contribute are having fair skin. So I have fair skin, but keep in mind that you can get melanoma no matter what shade of skin you have. So be aware of that. But fair skin does contribute. So for example, if you're prone to getting freckles, you have you have blue or green eyes or red hair. If you have a high number of moles throughout your body, so you might have a higher number of the dysplastic nevi, the abnormal moles. So when you have a higher number of those, that gives you a predisposition to getting melanoma. But remember, I told you those are the atypical moles. If you have a family history of melanoma or personal history of melanoma, that increases your chance as well. Did you know that melanoma is the 5th most common cancer among men and women? Next, I'd like to talk about moles and different things to look for when you're looking at your moles. So they have the guide, the A, B, C, D, E, but they've even extended some of those letters. So I'll explain those briefly to you. So A is asymmetry. So it's kind of like if you take your mole and fold it in half. Do those two halves match, or are they don't match? Basically, they don't match when you fold it together. That's asymmetry. Borders. Inspect the edges of your mole. If the mole has an irregular or jagged border, that could be something to be concerned about. Color. Examine the color of the mole. It should be a uniform color. Let's say, for example, brown or black. A problematic mole color will be not consistent. It may have areas of pink, red, white, or blue within that. I actually ended up having a blue nevus, which they removed that too. End up being not cancerous, but they had that removed and looked at that. Diameter is the mole should not be larger than 6 millimeters across. So that's bigger than a pencil eraser for diameter. E is for evolving. Evaluate your moles every month and also check for new ones. Track any changes that occur over time, even if they seem minor. They have some other ones. G for growing. Is your mole growing in size? F, does it feel firm to the touch? S, sensation. Is it itching, sore, or tingling? You as ugly duckling, that means does it stand out amongst your other moles? So again, keep in mind a mole, a spot that's changing, maybe a sore that doesn't heal, a new lump, a mole that's painful, itchy, or tender, an area under a fingernail or a toenail, redness or swelling around a mole, a funny looking mole, the ugly duckling. So those are some things to keep in mind. And one thing I might suggest is having you look yourself over, but having a friend or a spouse or an adult child or your best friend, somebody that you trust who you might want to entrust with checking out the spots you can't see as well, because a lot of my things, for example, are on my back, and I have a little mirror and it has a magnifying thing, and I try to hold it up in the mirror. So I hold this mirror and then I'm trying to look at my back, but it's really hard for me to get a good close up, right? So having that trusted person, and even going as far as to taking photos so you can compare over time how it changes. So, don't wait for your doctor just to maybe notice something. Don't feel the pressure that you have to. I also conversely don't feel that pressure that like you have to be the one to find everything, because you're not the expert, but you do know your body and you can see your body more often. But also I personally felt like, oh my gosh, what if I don't catch it and I don't notice it? So also don't put that pressure on yourself. But if you do notice something, then you do want to let the dermatologist know and try to get that checked out. And I do have sympathy for you too. If you don't have a dermatologist you can get into right away. I know I have a friend and she was concerned something might be a melanoma, but she luckily has not had melanoma, and it's hard for her to get in. It's almost like once you do have one, then you do get in sometimes a little sooner to get to see your doctor because they put you as a priority. But I feel bad for the people who are having a struggle trying to find somebody to see them. And you could go to like a general practitioner if you can't get into a dermatologist, and that would be good. But preferably, you like to see a dermatologist. But don't hesitate just getting it checked by a doctor. And I would say I was reading up about different apps they have out now that will look at your moles. I don't think the technology is quite there yet from what I can read about that. It's like the AI is fascinating how much AI can do, but AI isn't perfect. And it seems like from what I'm reading about some of those apps out there that they might just misdiagnose someone and say, oh, that's not melanoma, or this one is and it's really not. And so then you're worried that they're telling you it is if it isn't, and what if they don't catch something? So I personally probably wouldn't trust those apps right now. I don't think the technology is quite there. But one thing that I did read that was really promising is that some doctors now have, let me tell you what it's called. It's a thing, it's a mapping system. It's like a more complex way of taking pictures. So it's like a high resolution, a special camera. And it looks like insurance maybe currently isn't covering it, but some dermatologist office will charge you an extra fee. And hopefully over time, insurance will cover it. I hope they do. It's called Photo Finder. So that's something you can look up when you're looking at a dermatologist, or mention it to your dermatologist. Like, hey, did you know about this new technology called Photo Finder, where you can take these higher resolution photos and keep the system of my moles in a mole mapping? And I'm going to mention it to my doctor when I see her next about how she heard of that, and is that some kind of technology that she would consider. And I do feel like people, even though insurance wouldn't cover it, it's something that I personally would pay money to have done. I know not everyone can afford that, and I completely can understand that. And insurance is already expensive in itself. So anyways, that's just something to be aware of. And I want to thank all the people out there who also, like I said, I have compassion for the people who have further advanced diagnosis, but I also want to thank people who've gone through the trials, who have tested out new systems and new immunotherapies and been kind of on the forefront and kind of the guinea pigs. So for the rest of us who may end up getting like an advanced melanoma at some point. And so I want to thank you to those people, and tell all people who have melanoma who are currently fighting the battle or currently in NED, the no evidence of disease right now, that you guys are all warriors. And I just am hoping and praying for all of you. And I just feel like you are each strong in your own journey. And I hope that you have a good support system, good doctors, good friends and family around you to kind of help boost you up and be there. And I want to thank my husband and my friends and family who've been there for me. And like I said, I'm very grateful that mine is where it's at, but I'm also aware that that could change at some point, that it could pop up somewhere else for me in the future. I just want to thank you for your time today. And if you would like to make in the comments anything about perhaps a journey, your journey that you've gone through, or maybe someone you know, and we could, be a support system for each other and an encouragement. And so this is Graciously Gloria, and I'm wishing you all well.